Welcome to SMED 5342, Behavioral Health Interventions. This lecture is going to be a quick overview of the Behavioral Health Interventions course. So as we get started, you may be wondering what this class is all about and how this course affects your major, and even what you want to do in your future career path. To better understand this, it might be helpful to start with what this class is about: sport and exercise psychology and behavioral health interventions. This is the scientific study of people and their behaviors in sport and exercise activities and the practical application of that knowledge. Psychology affects so much of our lives. If you want to be a coach, how are you going to motivate someone to be competitive? What do you do with a player who has anxiety that is negatively affecting their performance? Consider teaching. How are kids impacted when they work in groups versus independently? And what impact does psychology have on the dynamics of leadership? How do children develop their communication styles? What about even being an athletic trainer? How does motivation, anxiety, and goal setting affect an injured individual or someone who is going through a rehabilitation process? How does psychology impact the predisposition to injury? And how does behavioral health and mental health impact sport and exercise participation? What about the rehabilitation process and even return to participation? There are so many aspects to consider. Through this course, we will examine how psychology can play an integral part in each of our future professions and learn how we can influence individuals' psychological processes. Psychology ABCs and the D's and the E's. Like other areas of psychology, sport and exercise psychology examines different aspects, sometimes called the ABCs, and the D's and the E's of psychology. A is for affect. This is a person's feelings. B is for behavior or one's actions. C is for cognition or cognitions, which is one's thought processes or thoughts. D is for dynamic, and E is for ever-changing. D and E go together because most situations are fluid. They change over time and with different stimuli, so that is why D and E are sometimes included with the ABCs. There are two primary objectives for sport and exercise psychologists to evaluate: to understand the effects of psychological factors on physical and motor performance. We could do this by examining such questions as: how does anxiety affect a basketball player's accuracy in free throw shooting? Does lacking self-confidence influence a child's ability to learn to swim? How does a coach's reinforcement or punishment influence a team's cohesion? Does imagery training facilitate recovery in injured athletes? And how does a healthcare provider's communication style influence a patient's adherence to the home rehabilitation exercise schedule and recovery? To understand the effects of participation in physical activity on the psychological development, health, and well-being, we could do this by examining such questions, such as: does running reduce anxiety and depression? Or, do young athletes learn to be overly aggressive from participation in youth sports? Does participation in daily physical education classes improve a child's self-esteem? Does participation in collegiate athletics enhance personality development? Or, does physical therapy influence a wounded warrior's physical health and help them to create a more optimistic view of the future? Most sport and exercise psychologists function to complete three different professional roles: that of a researcher, a teacher, and a consultant. Research often focuses on the inquiry aimed at advancing knowledge of the profession and sharing it through professional meetings or journal articles. Teaching may include functions such as instructing university courses in psychology or exercise and sports science. Consulting is probably the most public face of the profession. During consulting activities, individuals are working with athletes of all ages and abilities in a fitness industry, military, and in sports medicine and physical therapy. Sports psychologists are licensed mental health professionals who function as trainers, consultants, or therapists that assist athletes from all sport disciplines. They help athletes to rehabilitate after injury, deal with anxiety, improve athletic performance, and achieve their goals. Sports psychology interventions are designed to assist athletes and other sports participants, such as coaches, administrators, and even parents, from a wide array of settings, levels of competition, and ages, ranging from recreational youth participants to professional and Olympic athletes to master's level performers. You, as a future athletic trainer, may end up working with a sports psychologist, so it is important that each of us understand our role. As an athletic trainer, we wear many hats, and sports psychology is something that we can learn how to influence our patients for the betterment of their physical health and their well-being. This can also increase exercise adherence. We may be able to be a positive influence in our patients' lives, which may then result in more patient compliance and better performance outcomes. So it's important that we work together on multiple levels. The science and professional practice of sport and exercise psychology. The second part of this is to examine how science and professional practices affect sport and exercise psychology. There is a theory and a practice to sport and exercise psychology. We often say this in athletic training as well. We have to examine the science behind the discipline of sport and exercise psychology. To evaluate the protocols and the strategies to help individuals, we must rely on things that have been used before. There is a process or a method of learning about the world through the systematic, controlled, empirical, and critical filtering of knowledge acquired through experience. Some of us may have had experiences of having a moment in time where you did something that reminded you of a parent. How did you know how to react or what to say in the moment that it happened? You probably didn't. You just reacted based on your experience you had previously been through. Sometimes this is positive, while other times it is negative, and sometimes it just plain freaks us out that we are turning into our parents. A theory is an ultimate goal of the science of sport and exercise psychology. A theory is a set of interrelated facts presenting a systematic view of some phenomenon in order to describe, explain, or predict its future occurrence. One example of this would be social facilitation theory. There is nothing more practical than a good theory. The idea, then, is that we take this theory and then apply it to humans in a practical setting. This is not always a perfect science, which is why we are practicing clinicians. If we had it all figured out, it would not be practicing anymore. Then it would be kind of like medicine. There is not always a textbook case, and not all interventions work on every individual. There is a human element and individuality to all of it that must be considered as well. Re-aim model of knowledge integration. How well does research translate into practice? Is demonstrating effectiveness or efficacy enough? The development of effective interventions is clearly a priority among scientists interested in health promotion and the prevention of chronic disease. There is a standard method for determining if an intervention was or was not effective. In recent years, there has been questions raised regarding the necessities of evaluating other factors associated with these interventions. Issues such as robustness, translatability, and public health impact have all been identified as critical, yet they have been given relatively little attention when compared to the reporting of the effect on a given intervention. In contrast to the availability of information regarding intervention efficacy, there is no widely available systematic framework to evaluate potential for the translation to public health impact. To fill the research practice gap, Russ Glasgow and his associates designed an evaluation framework to expand assessment of interventions beyond the efficacy to multiple criteria that may better identify the translatability and public health impact of health promotion interventions. And that balances the emphasis on internal and external validity. This group proposes that the translatability and public health impact of such initiatives is best evaluated by examining all 5 of the following dimensions. R is for reach into the target population. E is the effectiveness or efficacy. A is for adoption by targeted settings, institutions, or staffs. I is for implementation, or the consistency and cost of delivery of the intervention. And finally, M is for maintenance of intervention effects in individuals and the settings over time. Hopefully this was a helpful start to this course and a quick overview. We're going to delve into many different psychological theories and behavioral health interventions as we progress through this course. I hope you enjoy it and we can find ways that you might be able to apply this information to your future career path.